Hey, it's Dr. Travis Johnson over at Hudson Spine and Health. What I want to share today is a technique called functional cranial release. And what this is it's a endonasal balloon treatment that I use this kind of balloon to insert within somebody's nasal passage to release specific pressures that are causing issues within the nasal passage, but also like head pressure and headaches. We have a lot of individuals that come in right now that are kind of sick and stuffy, some sinus infections, and sometimes just like a nasal rinse isn't enough. And so when we place this balloon deep within the cavity there, it'll expand within that cavity and release a lot of pressure and even fascial restriction that could be stuck in there for years. Sometimes you have this long, what we call chronic low-grade infection that can just live in there for long periods of time. And sometimes we need a physical release to actually drain that stuff out of the actual sinus. And we do combo this with a nasal spray that uses glutastat and some essential oils to kind of disinfect the area as well. But very safe and effective tool for somebody who has head pressure, headaches, any kind of sinus congestion or dysfunction within their face. We do a functional eye exam to determine how your brain is functioning with the actual eye movements. And this is a really good evaluation for me to determine if this is a treatment that is right for you. So if you can see here, this skull, what we'll do is we'll place this balloon deep within that cavity in a very specific location. And what the idea is I'm trying to release this sphenoid bone here. Okay, and as you can see, the sphenoid bone connects to all the other bones in the skull. And so by releasing the keystone of all those bones, we'll be able to actually shift the tension system within the brain and the spinal cord. We call this the meninges or the dura mater. And typically, people will see results after the first treatment, but this is something that we'd want to do a series of so we get progressive results.